My name is Gladys Njeri Washira. I'm a research assistant at the Institute of Public Finance. We are here to launch one of our flagship products, the Macro Fiscal Analytic Snapshot. It's a document that we produce every year since 2019, and it provides an outlook of the country's current status, macroeconomic, its debt status, and how key sectors are getting funded by the government, including health, agriculture, wash, and also we try and look at the donor landscape in the country and the kind of and the trends in the official development assistance that we are receiving from different donors and partners. Yes.
Can you tell us now, in terms of donorship, where do we stand as Kenya, especially in the health sector? Because I know that is what you're so professional.
Okay, the thing in the health sector, the trend that we are noticing is the decline in donor funding, and most of this is because of the fact that the country transitioned from a low-income country to a middle-income country. So the current position for most of the donors is that once you've transitioned into a middle-income country, you're in a better position than how they found you, so you can try and pick up and bear some more weight in financing some of your programs and your projects. Yes.
Do you think this is a disadvantage? Because now if you are transitioning to a medium earning country, now you are losing dollars. Is it good for us or is it bad for us?
I think it's good for a prepared country. If you anticipated that you're going to have growth, you should have been. I think countries should be able to make plans in anticipation of that decline in donor funding, and so you probably have reserves. You probably have already figured out how you're going to generate surplus revenue to finance those projects that are no longer going to be funded by donors. But for the country right now, I think we're in a bit of a worrisome situation, if we are being honest, because we are finding, and I think that's why we are having so many laws coming in, because everything that we are doing now is trying to adapt to the fact that donors are leaving, and the fact that and the fact that we need more revenue to finance what we've been doing in the projects and the programs that we've been running.
Yeah. You're seeing Kenya, it has a lot of debts, yeah? And how come we're already in the medium category or whatever, and we have a lot of debt that is following us, and donors are running away? Do you think now Kenya is going to sustain all this with all that in mind?
Honestly, I am it's one of the things that I'm waiting to see how they'll pan out, because honestly that's a very genuine question, and you can already see the worry that is there because of the Eurobond repayment that is coming up, and that's just one of the repayments that we have to make. So if we take into consideration all those other repayments, I think we need to brace ourselves as Kenyans for the times that are coming.
Yeah, you have seen because of this, yeah? Already you have seen that we have some declines and some falling in terms of now the government funding our health sector. Yeah? What do you have to say about this?
That's quite unfortunate. And the thing is this, when you look at the nominal numbers, you might think that it's actually increasing.
First of all, yeah, because for us you have already looked at the report. Can you give us now those numbers and what percentage and how our funding is falling?
Okay. Yeah. So first of all, we look at the budget documents that are given by the government are normally in nominal terms. Nominal terms means that they've not adjusted for the cost of living in the country. So they've not adjusted for inflation, because what happens with inflation is that it reduces your purchasing power. So the nominal numbers do not show that decline in purchasing power for Kenyans, but the real figures show that. And if you do your analysis with the real figures, you're seeing that budget allocations are declining a bit. And I think even without looking at the trends, we can see that the current proportion of funding that we currently have towards the health sector is not very great. Because we've said one of the things that we found is that it's accounting for only about 2.2% of the GDP. And if we are going to be realistic and say that we actually want to attain UHC, we should be at least at 5% of the GDP. Yes.
Yeah. And then you have seen that now this has affected how our county governments are being funded. Yeah. What percentage or what statistics do you have in terms of now the donorship that has declined in our counties?
In our counties. Yeah. So there is an interesting thing about donor funding is that there is donor funding that is on budget. On budget means that it's actually recorded by the government. And the problem with that is that it's very little that is recorded in documents. So if we are to analyze the donor funding to counties, it tends to be a bit difficult and murky, because we find that most of it donors choose to work with specific organizations for specific projects, and that one is not tracked at all. So we are not able to give a specific figure on how donor funding is being impacted at the county level because there's no reporting. And one of the reasons that we've highlighted in our study is the fact that the lack of reporting is normally mainly because donors do not trust the management of funds at the national level. Because of all these leakages we tend to have. I think NHIF proves to be a good case study of that. We've seen all the cases that we've had of corruption. A report by EACC last year ranked health as the most corrupt sector after the police and administration. So that's one of the reasons why it's not, most of the donor funding is off budget, it's not tracked.
Yeah. Who are some of the major donors and some of the notable donors that we have lost and have already now pulled out of our sponsorship?
Okay, the ones, I'm not certain if there's any that has fully pulled out of the country, but we are having two major ones that are going to pull out by 2030. We are having Gavi, it's supporting immunization in Kenya, and it bears most of the cost of our immunization program, yeah? So we are having that one transitioning out by 2030, and we're also having PEPFAR. PEPFAR has been financing HIV/AIDS in Kenya, and they're also planning on exiting the country. So, and for Gavi, if you want to understand the magnitude of the situation, trust that for every dollar that our Kenyan government invests in the immunization product, Gavi invests more than 3 times that. More than 3 times. Preliminary analysis indicate that if we are going to be able to sustain the immunization program after they leave, at least 4% of our budget needs to go to immunization. We already don't have that money. So the question is, what are we going to do by 2030? So we are waiting to see the transition roadmap that the Ministry of Health will come up with, because it should provide some guidelines on how we are going to cover some of these additional costs.
Yeah, you're talking about now donors running away. We have seen now that the government, we already have a big debt that is already surrounding us, What are some of those recommendations we would have to the leadership that can be put in place in order to ensure that we have now a sustainable health sector?
That's a very fair question. I think the first and main question is, the first thing that we should look at is how can we generate more revenue for the government to finance these healthcare needs. And in addition to that, I tend to be of the school of thought that we shouldn't always just focus on raising more revenue, but we should also focus on making sure that the little that we have is not being lost in any single. We are not losing any shilling from the system. We are not losing it from misuse. We are not losing it to corruption. Make sure that every single shilling allocated to the health sector actually goes to the health sector.
To the conclusion, what is your now call to action right now as we conclude?
As we conclude, I think it is important for us to actually have a roadmap on how we are going to deal with the changing landscape of financing in health. That includes identifying specific revenue mobilization strategies. And I know SHIF is coming in as one of the ways to bridge that, but I think in SHIF, one of the things that's there is the fact that people are crying out that the premiums are too high. I think there's also a need to balance the fact that we want to raise more revenue with the fact that we are trying to make the health insurance system actually affordable for the people. And the other thing is that we need to also, I think the government should really focus on making sure that there are no leakages. I think I'll keep repeating that, because we try and make sure that there are no leakages, because with leakages we lose the revenue that we could have invested in something. Leakages also make people very skeptical. So if you introduce new taxes on me, does that mean that I'm going to lose them to somebody else in their pocket? Am I going to lose it in corruption? But if people can see the value for their money, I think it can also make people want to actually contribute towards the revenue mobilization, and will be more acceptable of the strategies that we choose to adopt.
Thank you so much, Gladys.
You're welcome.
Tunaona, tunasikia na tutabonga. The voice.